that for our doc talk this afternoon, we have partnering with us Dr. Yashica Seymour and Dr. Dashawn Saunders. Dr. Seymour appeared with us before on our doc talk. It was very informative. And so we are really looking forward to what both she and Dr. Dashawn Saunders will share with us. So we encourage you to send this out. I'm sure many of us have family and friends with children who are, returning to school, and it is a very informative topic. It is one we're all concerned about. So I just want to thank the Bahama Health team who would have put this all together, that coordinate our doctors. And so without further ado, we will just move on with our panelists for today. So again, special welcome to all guests, but especially to our presenters, Dr. Yashica Seymour and Dr. Dashawn Saunders. Good evening.
Good afternoon, audience. I am Nurse Tanishka Bottomy, the manager of the clinical care unit here at Bahama Health. And today I have the pleasure of introducing Dr. Dashawn Ferguson Saunders. Dr. Dashawn Ferguson Saunders is the new chief of pediatrics and is presently a pediatric consultant with the Department of Pediatrics at the Princess Margaret Hospital. She completed undergrad studies at the College of the Bahamas and Acadia University, where she obtained an associate and then a Bachelor of Science degree in biology and chemistry. Dr. Ferguson Saunders then furthered her education by enrolling in the medical program at the University of the West Indies Faculty of Medical Sciences, where she served as Bahamian class president in her last 2 years of medical school before completing her medical training. Dr. Ferguson Saunders then joined the staff of Princess Margaret Hospital in 2006. At the end of her internship, she received the Distinguished Service Award for Intern Physician of the Year from the Medical Association of the Bahamas. She feels that the foundation for a healthy life is established in childhood, which makes pediatrics so special to Dr. Ferguson Saunders. She also completed postgrad training in the field of pediatrics through collaboration with UWI and PMA and was the first Bahamian to graduate from this program. She moved up the ranks in the Department of Pediatrics from senior house officer to senior registrar, where she has served in numerous leadership roles and is now presently a pediatric consultant, lead for her clinical ward team, services, and previous coordinator for the staffing and allocation. She has also served as Deputy Medical Chief of Staff at the Princess Margaret Hospital. Dr. Ferguson Saunders also directs the Pediatric Infectious Disease and her team's General Pediatric Clinic at PMH. She has continued her service lecturing medical students and was promoted from associate lecturer to clinical tutor at the University of West Indies School of Clinical Medicine and Research, where she is actively involved. She has also continued training with the Vanderbilt University and is certified in autism diagnostics. She loves the field of development and behavioral pediatrics and volunteers her time with the autistic community in the Bahamas, where she serves as one of the board of directors for REACH organization and works part-time in her role as a pediatric consultant at the Agape Child and Adolescent Clinic in the Hilltop Medical Complex. She is married to her loving husband and their devoted parents to their 3 lovely daughters. Dr. Saunders, welcome.
Good evening, and thank you for having me. All right, so let me share my screen. So thank you once again to the Bahama Health team, and I look forward to presenting on our topic today, the common cold, flu, and colds as we get ready for back to school. All right, so are you able to see my screen?
Yes.
Okay, good. All right, so good afternoon, everybody. Welcome to the audience, and I'm happy to be able to present, knowing that we're going back to school, we're getting ready for school season, but not just for school season, we have to be prepared. So we not only have to be prepared with our books and our pencils and our new shoes, but we also have to be prepared with the guidelines that our kids will need to have a healthy back to school season as we move on. And so today, my topic today will be time to check in, cough, colds, and flu symptoms in children. And so as we are aware, when we look at the common cold, cough, and flu, it's the most common illness in both children and adults. Infant and children are more commonly affected, and that reasoning being is because their immune system is not as robust as that as in adults. They have less resistance, and so as a result, they have a lot more colds. And so when we look at children compared to adults, a child less than the age of 2 can have almost 6 to 8 colds per year, when we compare it to adults that would normally just have 2 to 4 colds. And so this accounts for approximately 22 million missed days of school. And so when we look at our parents having to stay home with these sick kids, that's a lot of days and a lot of kids being sick. So when we look at the common cold and flu, there are 2 main categories. And so sometimes we overlap them, but our topic today is just so we can get a better understanding of common cold, of the flu, and you know, how they exactly present. So influenza, which is the flu, and the cold are both contagious respiratory illnesses, but they are both caused by different viruses. So we look at the flu is caused by the influenza strain, and we have 3 strains, and we'll talk about it a little bit more. And then when we look at the common cold has lots of different viruses. And so a lot of times in our pediatric offices, we'll see a kid, we treated them for the cold, and for the most part, it's supportive care. And then the mom calls back a week later, this kid is sick again, you know, and I always have to say to them, listen, we have so many colds out there. Once your child has gotten over one, they are definitely likely to pick up a next one. So the common cold and flu are easily spread, okay? So it starts from airborne droplets. So if that child is exposed to other kids who are coughing, who are sneezing, they release these droplets into the air, and your child inhales it, and you know, a couple days later, they then come down with symptoms. Other things are hand-to-mouth contact. And so when our kids are going back to school, we have to ensure that hand washing is key. We need to ensure that we're encouraging our kids to wash their hands. And not only that, ensuring that they have hand sanitizers or cleaning wipes to ensure that they are not placing their hands to their mouths. Other things in terms of infected surfaces, our kids will be using toys at some of the preschools. Our kids will be using pencils, sharing books. They even want to share lunch with their friends. And so all of these are ways that our kids can get infected. So school sessions are about to increase the risk of exposure to these viruses, because I always say to parents with schooling, you know, when I have a parent, they come all upset and they're like, I'm moving my child from that school because they're always sick. But I say to them, if your child goes to another school, the same thing is going to happen, because somebody else is going to send their kid to school with that runny nose or a cough. And as a result, your child will also get sick. Schools for a long time have been online. And so we, as pediatricians, it was so interesting during the COVID peak of the pandemic, we didn't see sick kids for almost 2 years. And that was because of the closure of school. And so now that kids are going to be going back into school, schools are now going to be indoors again. Our kids are going to be in closer proximity to other children. And so the risk of our children getting viral illnesses will once again come around. As we go into September and the winter season, we really don't have a winter in the Bahamas, but when we get our cooler days, we also will note that there will be a decrease in the humidity, and that will also affect the nasal passage. And so kids' nostrils will be drier, and so they're going to rub their nose a lot, pick their nose a lot, and all of these will increase the risk of our kids picking up the common cold and flu. So the question is, what does the viruses affect, okay? And so the cold and flu, they usually hang out in the upper airway. And so for the most part, we call it upper respiratory tract infections. And so starting with the cold, it usually affects the nose, the throat, the sinuses. And if it stays for a long period of time, it can become a lower infection infecting the lungs, or it can also move to the ears, causing ear infections. The flu is a little different in that it may affect the nose, it may affect the throat, so these kids may have sore throats, but usually if we are not on top of the influenza virus, this can actually go to the lungs, causing really bad pneumonias. These viruses, once getting into the body, they usually deposit in the mucosa of the nostrils. And once it is deposited in the nostrils, they then find the receptors. So we have little buttons in our nostrils and they get activated. And as a result, once those buttons in the nostrils are activated, they release a chemical or a hormone called cytokines, and that's what causes inflammation. And so once that has started, then you start to see the kids with increased runny nose. You then start to see nasal congestion. You start to have kids with itchy, scratchy throats, and then the saga goes on from there. So when we look at the common cold, there are hundreds of viruses. And so right now, the rhinovirus, this usually causes about 50% of the cases of the common cold. And if you look at the rhinovirus, it has about 100 different strains. And so I say that to say to parents that, you know, if your kid has not been to school before, they're going to school for the first time, be prepared because your kid will get sick, and it's not the school. It's just that our kids' immune systems will be a little low. And especially with COVID, our kids being locked up, don't be surprised that our kids may come home with the cough and the runny noses. So we just need to ensure that we are properly teaching our kids to wash hands. We're still in COVID season, wear masks, and ensuring that they're following all of the protocols. And if you have a sick kid, to please keep your kid at home so we don't make other children sick. And so other than the rhinovirus, there are other viruses that may cause the common cold, and these could call, for instance, the parainfluenza virus. And this one is very common for something called croup. I'll talk about it a little later. And with a kid that has croup, they usually have what we call a barking cough. And so some parents call it a seal bark cough, a dog bark cough. But when you hear that kid with that harsh cough along with a fever, we have to start thinking whether that's a viral infection caused by parainfluenza. When we look at adenovirus, once again, another organism, these kids may have the cough and the runny nose, but in addition, they may have tummy symptoms, so such as diarrhea, such as vomiting. And so we have to be wary of that. The RSV, or the respiratory syncytial virus, is another common virus that we would see in our children, but this one is usually more in our infants. And so a lot of times we see it in our babies. And so if our babies are exposed, our babies may have low grade temperatures. In addition, they may have what we call happy wheezers. So they may have noisy breathing, they may have cough, and all of these, once again, are viruses. We also have the seasonal coronavirus. I know coronavirus has been in the news. I think we're all tired of COVID and we're tired of hearing about the coronavirus, but hey, this is nothing new. The coronavirus has been around for a while, and it also causes symptoms of the cold. And so, you know, these kids may also have cough, runny nose, and fever. But I'd be remiss if I didn't mention SARS-CoV-2 or COVID-19. It's still with us. We're still seeing children affected. For the most part, most of our kids are mild, but you know, we still see some kids that are symptomatic. We have kids that have to come to the hospital. We do have kids that have to be hospitalized, and definitely Dr. Seymour will speak more about that as we continue this talk. And so when we do a comparison with the common cold versus the flu symptoms are usually a lot worse. And when we look at the flu, as indicated, there are three main types, but it's influenza A and influenza B. These viruses are usually seasonal, and type C can also sometimes cause illnesses. But right now in our country, and over the last few weeks to a month or two, we've been really seeing bad influenza A viruses come to our office. So the question is always, is it a cold or a flu? How do I know? How, as me as a parent, how can I differentiate between the two? So just a couple rules of thumb, and this here guideline was released by the CDC. And so when we look at starting off with the symptoms, so a kid that has the cold, it's usually gradual in onset. So that kid may start with congestion, stuffiness, you know, 2 to 3 days later, they may then start to have a runny nose. If they do have a fever, it
You went on mute.
Oh, sorry about that. Okay, so talking about, is it a cold or flu? And so, you know, a lot of parents want to know in terms of the comparisons of it. And so when we look at the cold, it's usually gradual in its presentation. And so a kid may start off with congestion, 2 to 3 days later, they may have a runny nose. And by the end of the week, they have a cough. If they have a fever, it's usually low grade compared to a flu. The fever comes day one, all right? So they may have been exposed to a child or even an adult, and 24 hours later, they have this high roaring fever, and we're talking 103s to 105. With the flu, these kids may also complain of muscle aches, have chills, they may be fatigued, they may be tired, they may be weak. When we look at the flu symptoms, it's usually a lot more severe than the cold. And so the kid with the cold, they may have a sore throat, they may have a stuffy nose, they may have sneezing, but they usually wouldn't have the aches, they wouldn't have the chills, they wouldn't have the fatigue. And so when we're seeing this comparison, that we have to think that, this may be the flu that is presenting and not necessarily the cold. So when we look at the common cold, what are some of the symptoms? As indicated, the cold usually presents about 2 to 3 days after exposure. They usually have congestion and runny nose, and you really always have to talk about a runny nose because parents really get excited by colors, and we as pediatricians, colors are not exciting for us. And so yes, a child would start off with a clear nasal discharge, then it goes to yellow, then it goes to green, but things that, and so when I see a kid with a yellow or green nasal discharge, it's actually a good thing because it means that their immune system has kicked in, the body is producing white blood cells that are really trying to fight the infection, which is of course viral. But we would then get excited with duration, not color. So if we have a kid that has a runny nose for about say 7 to 10 days, at that point, then we have to say to the parents, your sinuses are likely becoming inflamed, and this thing is probably evolving from a viral infection now to something bacterial. So it's not the color, it is duration for us. And so as indicated, they may have low-grade fever. Other symptoms could be sneezing, sore throat, and cough. And in our infants get the cold too, but their presentation is a little different. So they may be a little fussier than normal. They may be irritable. They may have difficulty sleeping. They may also have a decreased appetite. And for some of our children, they have allergic rhinitis, which is that kid that has the sneezy, the itchy, watery eyes. This sometimes also is interpreted as the common cold, but for whatever reason, this kid may have been triggered, their allergy symptoms can also overlap with the common cold. So when we talk about influenza, as noted, these kids look ill. They have headaches, they have body and muscle aches, they have a cough. That cough usually worsens, and running a stuffy nose is very mild. And most of these kids usually are contagious 24 hours before their symptoms even start. So if you have a kid, and they're complaining of fever, mom, I don't feel well today, I feel a little feverish, or my muscles hurt, oh, my throat feels a little sore, that's the kid that you want to keep home because that child may have been exposed to the influenza virus. And, if we allow that kid to go to school, they then make other children ill. So COVID-19, I have to always mention it. So guess what? It overlaps. So a lot of times we have parents who think that it's just a common cold, but it could actually be COVID. We're still in season. And yes, even though our numbers have decreased drastically, we're still having children and adults that are being contaminated with this virus. And so how do we know if it's COVID or not? So a couple of things. So history is always pertinent, and we'd want to know, first of all, with exposure. And so usually if a child has been exposed to somebody that may have had COVID, I always say to parents, you find somebody with COVID and they want to run and get tested, did they know? Ideally, if this child has been exposed to COVID, they're not usually going to have symptoms until 3 to 5 days after the illness. And so with COVID exposure, and if the child has become infected, they will have symptoms 4 to 6 days after. So for the most part, most of our children are mild and asymptomatic, but that's not everybody. Okay, and so some of our kids may have fever, some of our kids may have a non-productive cough. Other symptoms with COVID can be real congestion. Some kids may have abdominal pain. Some kids may present with vomiting and diarrhea. And look here, all of these sound just like the common cold. And so we have to ensure that if our kids are sick, that we're keeping them home, we're getting them evaluated so we can ensure that we know what exactly is going on with our kids. In older children, and so when we have our older kids coming to our office and they're saying, oh, my kid has a fever and sore throat, for us, we say to that parent, hey, we really need to ensure that this is not COVID. We ask about that history of exposure. And a lot of times we say, hey, you maybe should go and do a rapid antigen just to ensure that this is not COVID. And so for our older children, a lot of them may present with loss of taste or smell. And some kids may develop rash and have a persistence of fever and along with red eyes. And for us, that is a big concern because that can tell us that maybe this kid may be developing a complication as a result of COVID. And so when we talk about cough in children, cough is really not a diagnosis. And so cough is usually an indication that a respiratory illness is happening in this child. And cough is usually problematic for a couple reasons. First of all, it causes discomfort for the child, but not only discomfort for the child, it causes sleepless nights for parents. Because a lot of our kids, the cough may be more at night, and so as a result, they're coughing. And so, a parent is tired because they got to be up with that sick child. And so what we want to know is the duration, how long a kid has been coughing. So if a kid has been coughing maybe a day, 2, 3, it's not a persistent cough, a couple times a day, likely just a viral illness. We'd want to also know if it's a wet cough, is it a dry cough? Are they bringing up cold or phlegm with the production of the cough? And you also want to know timing. All right. So if a parent is saying to me that, I've had a child and this child has been coughing for 2 weeks, that's a little bit more than just a viral infection. We then want to know, is it a nighttime cough? Does this cough wake child up from sleep? Does this child have a history of eczema? Does this child have a history of allergies? Because, hey, a nighttime cough for about 2 weeks could be asthma. Other things you'd want to know about coughing is, was there any exposure to travel, whether this kid has fever and chills with a cough? You'd want to know if it's productive, if it's blood tinge. Hey, that could be TB. And so a cough is a symptom. And so it allows us to make a determination of what exactly is triggering it. But for the most part, most kids that present with cough, it's usually due to upper respiratory symptoms, such as the cold or the flu. And specific causes of cough can be things like asthma, croup, which would be the barking cough, with bronchiolitis, they could be wheezing and cough. And a kid that has pneumonia, which is a complication usually of influenza, can have a really wet sounding cough. And so what are some of the complications of the cold and flu? So if a kid has had a prolonged cold or flu, complications can include otitis media. And what is that? That's an air infection. So children with colds or flu-like symptoms, they may definitely have fever, they may have ear pain. And studies have shown that 30% of preschool children with the common cold may develop an otitis media. And this is usually seen in higher risk kids, so those between the age of 6 to 11 months. And so if you have that kid with that cough, that kid that's complaining of ear pain or boxing the ears, I would say to you as parents, please get your child evaluated. Wheezing is another complication, and viruses can sometimes trigger wheezing. But hey, if a kid has asthma and they also get the common cold, this can also worsen their symptoms. Sinusitis is another complication of the common cold, and these are the kids that have been having prolonged nasal discharge for at least 10 days. And so if that's happening, you definitely would want to be seen and evaluated. And so complications of the flu, we talked about the common cold. And so when we look at the flu, some of the complications can be pneumonia, it can have cough. These kids can have worsening respiratory distress. And in some severe cases of the flu, it can even lead to death. And so, we just don't want you as parents to take things for granted, or this is just a cold, or this is just a flu. You want to ensure that you're watching and that you're observing your kids closely. And when we talk about COVID has its complications too. So even though it is, for the most part, asymptomatic in most children, some of our children can develop an illness called MIS-C, which is multi-system inflammatory syndrome in children, or some of our kids can even get inflammation of the heart, known as myocarditis. And these are serious complications, and these would involve hospitalization. So how do we treat a cold? What do we give? And so for the most part, I'd say it's supportive care. First things first, you want to ensure that you're controlling the fever. And so you want to give acetaminophen, and that's your Tylenol, that's your Paramol. If a kid is over 6 months, the kid can get ibuprofen. So that's things like Motrin and Advil. You want to ensure that your kid is having adequate hydration, drinking lots of fluids, Gatorade, water. You want to ensure that if they're stuffy and congested, you're using your saline drops or even your saline sprays. And a lot of times when kids get the cold, they go to the pharmacy and they ask the pharmacist, what can I use? And so we do not recommend over-the-counter medications for kids that are ideally less than 6. And that's based on the American Academy of Pediatrics guidelines. You really should consult with your pediatrician. One of the reasons we don't recommend a lot of the over-the-counter medications is because I don't want to call names, but if you look at some of them, they say cough and cold and fever. And so they got like 5 or 6 different medications thrown into one. And so things that can happen is you can overdose a kid, so you may not be properly dosing it. Other than that, side effects of those medications. So sometimes the kids can be lethargic and drowsy. Is it the medication? Is it the illness? And then everything has complications, and so with overdosing, that could lead to liver failure, among other things. So you really should be consulting your pediatrician or somebody in the medical field before you're just going to the pharmacy and purchasing medications. Antihistamines is another medication that we would recommend, and that's for kids that may have congestion, runny nose, sneezing, but once again, with consultation. So the main point to say here, though, there are no antibiotics, because parents always come, oh, my kids had a cough, or my kids had a fever for a day, I need antibiotics. No antibiotics are needed for the cold or the flu. Other medication includes nasal decongestants or nasal sprays. And once again, consultation, just don't go and buy over-the-counter things and use it for your kids unless you're sure on what you are using. So how do we care for our children during the cold and flu season coming up? First things first, cover your cough. Sneeze in a tissue. A lot of parents tell kids to sneeze in the hand, but hey, you got to wash your hands afterwards, because if you sneeze in your hand and then you go and touch other objects, you touch your friend, you're passing the virus on. We're still in mask season, and so we'd encourage parents for kids older than 2 that they're wearing their mask, that they're wearing their mask properly, because COVID is still here, and not only is COVID still here, we're heading into cold and flu season, and so we have to be very careful. So you want to ensure that you're washing your hands well. You want to avoid touching your eyes, your nose, or your mouth. You want to ensure that you as parents are cleaning, and even the schools, that they're cleaning and disinfecting high-touch areas. You want to ensure that your kids are going to bed on time. Sleep is a beautiful thing, because if a kid gets adequate sleep, they can function during the day. So you want to ensure that they're sleeping, ensure that they're exercising. You want to ensure they're drinking plenty of water. And also, I'm just going to quickly talk about vaccines. You want to ensure that they're getting influenza vaccine, because we're going into the fall season, and every fall, the flu vaccine comes out, and definitely we want to encourage it. So persons ask, why should I get a flu vaccine every year? And there are a couple of reasons. There are usually small changes in the influenza virus, and this occurs continuously, just like COVID. We noticed that, COVID started off with the Alpha, then it went to the Delta, now we're at the Omicron. And so as you can see, these viruses change. And so as the body changes and with these viruses, new strains may come about, and your body becomes immune, meaning that it becomes resistant. And so as a result, we recommend the annual influenza immunization. And this vaccine targets influenza A and B. COVID-19 vaccine in children, I just have to put a plug in. The Bahamas now has the vaccinations here for children 5 and older. And, people are like, why should I vaccine? So a couple of things. The COVID-19 vaccine is surely the best way to protect everyone from severe illness and death. And I know Dr. Seymour will definitely talk about some of the cases that we see with hospitalization. It also will allow for safe return to many of our pre-pandemic activities, and at the same time, helping to reduce transmission. It also would help protect kids who may not be initially sick with, may have had COVID about 6 weeks or a month ago, and they can come back a few weeks later and have serious illness. And so we definitely encourage immunization, because the more kids are immunized, it would decrease the risk of hospitalization and intensive support. And we have been seeing cases, and something that we are noticing now with the presentation of COVID, we're now losing more children to acute COVID than influenza. So definitely we'd want to encourage vaccination. So you as a parent, when do I become concerned? So if that kid has a cough and cold for more than a week and it seems to be getting worse, your child is having difficulty breathing, your child is having high fevers, and I'm talking like 103s, 105s, and that's a persistent fever, not breaking, for more than 48 hours. Your kid is complaining of severe headaches. Your kid is having a significant sore throat with a muffled voice, refusing to eat or drink anything. If your kid is confused, your kid is lethargic and confused, hey, these are red flags and problems. You need to take your child in. Other concerns would be severe abdominal pain. Your kid is complaining of pain or pressure in the chest. Your child is having trouble staying awake. They're just falling asleep. They're lethargic. They're drowsy. Or your kid's color has changed. Your kid looks bluish in the lips or the face. Then this is an emergency. And you don't want to be sitting at home and trying to figure it out. Yes, the common cold and the common flu, for the most part, are mild and maybe asymptomatic with a cough and a fever and a runny nose. But if any of these occurs, then definitely that kid needs to come to the hospital. And at this point, I will close off to let Dr. Seymour jump on, because she will now be talking about when these are concerns and when it's more than just a common cold or flu. And so thank you for allowing me to participate, and I will put myself on pause and then we'll take questions after Dr. Seymour has finished. So thank you.
Thank you, Dr. Saunders. I'm happy to hear you say that we will entertain questions at the end, because I'm sure our audience are bursting with questions and concerns for their little ones. So I will invite now Nurse Monroe, who would introduce Dr. Seymour.
Good evening, everyone. Once again, as Nurse Bonamy has said, I'm Nurse Monroe, and it is with great pleasure that I introduce our second speaker for today's session. Dr. Yashica Seymour Hanna is a pediatrician with a subspecialty in pediatric critical care. She is a graduate of Queen's College, the University of the Bahamas, University of the West Indies, and Acadia University in Wolfville, Nova Scotia, Canada. Dr. Seymour Hanna began her medical journey at the University of West Indies in Trinidad and Tobago. Thereafter, she worked at Princess Margaret Hospital for a few years in the Department of Pediatrics, which inspired her to pursue further education at the University of Medicine and Dentistry of New Jersey. There, she completed her residency in general pediatrics and then a fellowship and subspecialty in pediatric critical care in Madison, Wisconsin. In 2016, she made the decision to return home to the Bahamas to become its only pediatric intensivist. She presently works at the Princess Margaret Hospital as a pediatric consultant and at the Doctor's Hospital, where she holds the post of Chief of Service in the pediatric department. Dr. Seymour is also a lecturer at the University of the West Indies School of Medicine and serves as a pediatric advanced life support instructor to further enhance the delivery of critical pediatric care in the Bahamas. Her passion and dedication to the pediatric field has led her to become the proud owner of Cesslyn Pediatrics, named in honor of her late mother. This family-centered practice specializes in the provision of excellent general and complex pediatric care to the nation. Ladies and gentlemen, please join us in welcoming the wonderful and inspiring Dr. Yashica Seymour Hanna.
Thank you very much, Ms. Monroe, that I almost didn't know who you were talking about. But I appreciate it. Okay, so I am just going to share my screen and we will get started. Okay, can everyone see? Okay. So while this computer is deciding what it wants to do, I once again want to say thank you and good evening to everyone. So with regards to my presentation, I'll put a little more focus on when the cough and cold is not really a cough and cold. And this can lead us to have to go to the hospital and be admitted, or it could just lead to having to have additional treatment. Now, you will see that there's a lot of overlap between my presentation and Dr. Saunders, but that is okay. Repetition is a great teacher, and so if you hear it twice, that means it's something that you should remember. All right. So the objectives for my presentation will be to define the common cough, define the common cold and influenza. If it's a topic that we've gone over before, I will go over it quickly. We'll then list the common viruses that can cause the common cold and influenza, describe the symptoms and management of the common cold. We will then describe the complications of the common cold and influenza that will require hospitalization. We'll discuss the approach to severe complications of the common cold and follow-up care. And then finally, recognize when to see the doctor. So just a little definition, the common cold, and Dr. Saunders presented this already, also known as the cough and cold, is an acute self-limiting viral infection of the upper respiratory tract. I think we both have the same sentence, but I just want you to emphasize the fact that it's acute. That means it came. It's not a chronic illness. It just comes on and it will come off. And self-limiting means that if you do absolutely nothing, it will go away. It affects the upper respiratory tract, and I just put this diagram up here so that you recognize when we talk about upper respiratory tract, we talk about anything from the level of the voice box. So when you hear a person is hoarse, that's usually the voice box that's being affected. So from anywhere from the voice box, go up. Now, of note, influenza virus is a cause for the common cold. It, however, requires special mention because it usually causes more severe illness. It has an abrupt onset. Your child goes from 0 to 180 in a minute, in a day. They would also have this quick onset of fever, headache, myalgia, and malaise. Now, when it comes to viruses, and Dr. Saunders did mention this, once again, just to highlight rhinovirus, there are more than 100 serotypes, and rhinovirus is responsible for up to 50% of the common cough and cold. Respiratory syncytial virus, I also wanted to mention because this is the one, yes, that's in our infants and also in our preterm. And so this has a factor to play when you're thinking about which patient you're seeing. So if it's a preterm child who's presenting with the cough and cold, we will be a little suspicious that that patient may have RSV. And the reason we're suspicious is because it can sometimes cause this condition called bronchiolitis. And bronchiolitis is an infection that is not of the upper respiratory tract, but it actually affects the lower respiratory tract. So basically from the voice box go down. And the reason we need to be aware of this is because these are situations in which, okay, you can't just kind of watch and monitor. This is the child that you actually want to be seen by the physician, and the physician will make a decision in terms of whether or not the patient needs to be admitted. Influenza viruses, she spoke about, and I will get to a little later too. There's the 3 serotypes A, B, and C. You also have your parainfluenza virus, adenovirus, enterovirus. And as you see, you know, the percentage that they contribute to the common cold is not as great, but they do still contribute to the common cold. You then have your SARS-CoV-2, that's the severe acute respiratory syndrome. The percentage, of course, is not quite known just yet because this virus just came about. So with time, we will be able to get some data on that. And in addition, it can cause your COVID-19, which is a very important illness that is not the common cold that we will talk about also. And then you have your common cold coronavirus, which is an example of your SARS, but these are the older ones that have been around. And so they account for 10 to 15% of the common cold. And these viruses can also cause pneumonia and croup. Then finally, you have your human metapneumoviruses. Its prevalence is unknown once again, but it can also cause pneumonia and bronchitis, basically the bad cough. Now, we talked about transmission already, hand contact, isolation of small particles, deposition of large particles, so I won't go into that too much. When it comes to symptoms, and I'm going to go over this briefly, they vary from person to person. I just wanted to reiterate that not everybody responds to the cold the same way. It depends on the age of the child. So the way a 4-monther will respond to a cold is going to be completely different from the way a 16-year-old responds to a cold. It depends on the person's immune system. If the person has a very robust immune system, they can kind of respond quickly and get over it quickly. And then it also depends on the causative agent, meaning the virus that is involved. Like Dr. Saunders said, if it's an infant, usually they present with fever, nasal discharge, fussiness, difficulty feeding, decreased appetite, and difficulty sleeping. For our preschool and school-age children, they have nasal congestion, nasal discharge, and cough. Now, I just have to put my plug into Dr. Saunders, sorry, she took it. But I want to emphasize once again, because I think every single pediatrician has the same scenario where you have a parent coming to you and say, oh, doc, I know this is just a cold, but the discharge from the nose has turned green. And so they come actually anticipating that, oh, okay, that means it's a bacterial infection, and so they should get antibiotics. Once again, I want to reiterate what Dr. Saunders says. It does not mean that it's a bacterial infection. When we have a viral infection, it infects the mucosa of the nose. The cells that get infected release those cytokines, and the cytokines then tells the fighter cells, hey, come over here, we have an infection going. And those things are called polymorphonuclear cells. When you have a robust response, and you have a lot of these cells present, that is when it goes from being clear to now yellow or white. Then what happens is these cells are actually fighting. They're like, okay, we have some foreign bodies around here. We got to get rid of this. We got to get rid of that. And so they also have enzymes that are being released, and they're breaking up cells and trying to get rid of the bad guys, trying to get rid of the virus. When that happens, that's when it turns green. So the presence of green nasal discharge has nothing to do with whether or not it's a bacteria or a virus. It is still a virus. It's just that the body's immune response is now at a separate point in time where the enzymes are now active. Okay, so in addition, we have the sneezing, you have sore throat, headache, and malaise. All right, so this is just a recap. Like Dr. Saunders said, she gave a very detailed presentation. When it comes to management, you want to talk about education and symptomatic therapy. I just put my little plug right there. No antibiotics. If you get nothing else from this, it's no antibiotics for a common cold. Now, when it comes to complications, so this is now when we say, okay, something just ain't right. We may have to entertain some other diagnoses or a consequence of the common colds. So the first one is acute otitis media. So if you remember, the nose, the throat, and the ears, they're actually all connected. And so when someone has a common cold, it starts off as a common cold, but they have a buildup of pressure inside these systems. And when that pressure builds up in the middle ear, so in the middle ear, there's an increase in pressure. They can also sometimes get a secondary bacterial infection, and then you have something what's called an acute otitis media. That patient will actually present with ear pain. If they're younger and they can't localize, you'll just see them boxing. That's what the boxing of the ear is. But basically, you would be able to tell that, hey, there is something going on in the ear. When the physician looks, what we look for is something called a light reflex and the mobility of the ear. And so there's certain things that tell us that, hey, okay, this is beyond a cough and cold. This now involves the middle ear infection. And so then we would treat appropriately, which would be antibiotics. The next complication that can happen as a result of your child having a cough and cold is conjunctivitis, which basically is when you have that redness in the white part of the eye, or you can actually have an eye discharge. So usually when that happens, it requires additional therapy. So we won't just use fever medication, or we won't just use antihistamines plus or minus. We won't just use decongestants. You actually have to use topical antibiotics, those antibiotics that actually go in the eye. Now, this is special mention because conjunctivitis can be something that's a complication of the cold by itself, or it can be a complication of the cold that's a part of another illness, which we will get to. Next, sinusitis. And I was just smiling to myself because at least we're all on the same page. Like Dr. Saunders mentioned, if you have a cough and nasal discharge that's lasting longer than 10 days, then you qualify. So if the nasal discharge is green and the patient has only had this nasal discharge for 3 days, do not expect antibiotics because you cannot make the diagnosis of sinusitis just yet, but rather once the symptoms have lasted greater than 10 days, then we move into the realm of, oh, okay, the sinuses, because remember, everything is all connected. The sinuses are now getting involved and we may have to do additional therapies. Pharyngitis, if you remember from the picture, it's basically when you have the back of the throat, that can also be affected as a complication of the common cold. And what happens is when you look in the mouth, you see that the tonsils in the back of the mouth are swollen, and sometimes they even have this kind of what looks like pus drainage. And so we call it an exudative tonsillopharyngitis. And so if you have a situation where the child is, let's say, not eating and not drinking, absolutely that child needs to be seen. And as a physician, what we look for, and like I tell my patients, the purpose of the physical exam is just for us to make sure that there's nothing else other than a common cough and cold. And if we see this, then we move that into the realm of it being a complication of a complication of the common cough or cold. Asthma exacerbation. So sometimes you can have a viral infection. Yes, it's affecting the upper respiratory tract, but if a child has a history of asthma, it can actually affect the lower respiratory tract. And so these patients will present with respiratory distress. Now, what is respiratory distress? If you look at me, you really can't tell that I'm breathing. I look fairly comfortable. You don't hear any abnormal sounds, and you don't see any increases. Kind of hard to see with the extra adipose, but you don't see any increased muscles working. But what happens is when you have someone who's in respiratory distress, sometimes you see their nose flaring in and out. It's like they try to get the air to move in and out. You can sometimes also see right here, this little notch at the bottom of your neck is sinking in. You also could see the muscles, we call it the use of the accessory muscles. So you see that they're using their accessory muscles to get air in and out. Exhalation, which means getting air out of the lungs, is usually a passive process. You do what you need to do to breathe in, and then you relax and the air comes out. But with these patients, they actually have to fight to get the air out. So you'll see them take a breath and then go, so they're working very hard. And then you hear that sound wheezing. And the sound is usually heard once again when they're trying to get the air out. Now, those patients, they need to be seen right away and possibly end up being admitted. So then we talk about febrile seizures. What this is these are basically uncontrolled changes in a child's behavior, movements, or feelings, and their levels of consciousness. Sometimes a virus, a common cold, can actually, it's more related to the fever. The rapid rise in the fever can actually cause a child to present with a seizure, and that child actually should be evaluated. Not all children will require admission, mind you, but they do need to be evaluated by a physician. Then we have our lower respiratory tract infection. So I talked about asthma and respiratory distress, which more has to do with what we call bronchoconstriction with the asthmatic. So the airways are just getting smaller because mucus and gunk is in there. But with lower respiratory tract infection, this one is actually as a result of there being an infection. So it could be a viral infection, but we usually end up coming to the hospital more for a bacterial infection. And so this is where, once again, it's the lower respiratory tract. So it's the lung parenchyma. So it's basically the tissues of the lungs that are being infected. And that is way beyond the common cough and cold. These children, once again, they will, in addition to having the increased work of breathing and having the prolonged expiratory phase, which may or may not be present, what you will notice with them is they're breathing fast. So you'll see the child so you don't necessarily have to hear them or hear a particular sound, but what happens is, because once again, the interface for where oxygen is exchanged is now filled with fluid because of the infection, and so they have to breathe fast in order to meet their oxygen demands. So if your child all of a sudden starts breathing fast, please do not hesitate. Your child needs to be seen by a physician. And then this is the second to last one. One of the biggest complications right now of SARS-CoV-2, like Dr. Saunders mentioned, is something called MIS-C. So it's the multi-system inflammatory syndrome in children. And this is actually a life-threatening condition that can happen. So it's not directly a complication of the common cold, but it is a complication of this virus that can also cause the common cold. This one, I cannot tell you, I would say this condition during the COVID pandemic has probably kept me up the most, because what it is it's basically a child gets exposed, and we know generally that when it comes to COVID, children do better than adults. But this is the condition where it actually is a little bit more detrimental and life-threatening. So what it is where the child gets exposed to the virus. The virus actually isn't the problem. The problem is the immune system. So remember, once again, we talk about the fact that how a child presents depends on their age, the causative agent, and their immune system. And so what happens is the child's immune system has an exaggerated response. And it means that you have all of these cells coming in and they're fighting, they're doing what they need to do, but they're actually affecting their own body. And so what happens is you get all of this inflammation that can occur around the heart. You get this inflammation that can occur around the lungs and the kidneys. The other thing is, remember I mentioned conjunctivitis. These kids can also present with conjunctivitis. So I had a she was 15 at the time, who was being seen by the surgeon for appendicitis because she was having severe abdominal pain. And there was this astute ER physician who just said, hey, doc, something just isn't right, because the child has this red eyes. She ended up testing positive for COVID. And then at one point, just for one reading, her blood pressure was a little low. And all I could say was, oh my God. So these patients, they are extremely sick. I cannot overemphasize that enough. So if you see your child is having fever, and this fever is very high for greater than 3 to 5 days, there's some red eyes, the child is very listless, like that's how this patient presented. She ended up having MIS-C, which we treated, which I will get to on the next slide. But this is probably one of the most concerning complications of the COVID-19 virus when it comes to the pediatric population. And like I said, once again, it is not that it requires antibiotics or even antiviral, but it's basically the child's immune system having an exaggerated response until the fact that it's affecting its own organs. Now, I cannot forget to mention influenza. I think we've heard a lot about this with the COVID, because when we talk about swine flu, this is what we're using as our template. So in 2009, there was an H1N1 pandemic, and it was all over the news. And can I tell you, so I ended up going off to the US in 2010. So I went right after the pandemic. And this was, what should I say, probably the most difficult condition for intensivists to treat at that time. So I just wanted to reiterate that, yes, it can start off as the common cold, but this can actually affect other organ systems and lead to a patient or a child requiring admission. This was a study that was done in Switzerland, and they had 326 children during one pandemic who was admitted as a result of having influenza A. Most of the children actually were less than 5 years old. So that was the majority for the age group, so less than 5. And out of the less than 5, probably about 20% was less than 1 year of age. And they found that these children, they had a lot of different things for which they were admitted for dehydration, they were admitted for respiratory distress, different things, but the biggest thing for what they were admitted for was pneumonia. So remember, once again, when it comes to a common cough and cold, one thing that we tend to worry about is pneumonia. And so these children, they ended up having to get antibiotics. Some of them got antiviral medication. And in addition, they required mechanical ventilation. So this is where, remember I told you, when it comes to pneumonia, you're trying to get enough air in, oxygen in, carbon dioxide out. And so mechanical ventilation is something that we do so that the body doesn't have to do all the work. And so we use the machine to get oxygen into the lungs and to get carbon dioxide out. I know it's a very scary thing for a parent to see. And so, but this is probably one of the most common complications that we see in the ICU as a result of a common cold. I pray nobody ever has to go through it, but we do believe that education is key. And so if you notice that your child has any degree of respiratory distress, do not delay your child being seen by a physician, which means if it's happening 3 o'clock in the morning, don't wait until your pediatrician's office is open. You have to go to the emergency room. This we'll go through quickly because I did mention some of the treatments. So for the acute otitis media, it's antibiotics. Conjunctivitis is antibiotics that go to the eye. Sinusitis, antibiotics. Pharyngitis, antibiotics. Asthma exacerbation, it's your rescue medication. So your albuterol, ipratropium bromide, plus or minus admission. Febrile seizures usually treat the cause for the fever. For your pneumonias is antibiotics, oxygen, plus or minus admission. And then for your MISC, it's admission first. They're going to get steroids because, like I said, it's an inflammation. It's the body reacting to itself. And so they usually have to get steroids. They get anticoagulation and something called immunoglobulins. I'm not going to go into all of that about what they mean. You don't need to know that. But what you do need to know is that that is probably the worst complication that can happen of if a child should contract COVID. Okay, so the big question, when to see the doctor? Your child has a cough and cold. They've had them before. They've probably had 3 or 4 before, and they were fine. When do you say, hey, something ain't right, let me go and see the doctor? One, if your child is younger. So usually they say about 4 months of age and younger, you want to make sure your child is seen by their pediatrician or a physician. 2, if they're having trouble breathing. So remember, I talked about the noisy breathing. You can hear the wheezing, even if you hear stride or something like that, or they're breathing fast. We call this tachypnea. So the child usually would take about 20 breaths in a minute, but now they're taking 30 or 40 breaths per minute. They need to be seen. If the child gets a cough after they choke on a food or another object, they need to be seen. Now, this I included not because it is a complication of the common cold, but because it can present like the common cold. And once a child has cough, usually people think it's common cold. But this scenario is more about a child that aspirated, so they were eating and it went down the wrong pipe. And so if there's a foreign body that needs to be removed, and so that child needs to be seen. If your child is coughing up blood or yellow or green mucus, the child should be seen. If your child is refusing to drink anything for a long time. So what is a long time? Basically, if you know your child usually passes urine, you have to change the diaper, let's say every 4 hours, every 6 hours, and you notice that you're going 8 hours, 12 hours and not changing the diaper and the child is not drinking, that is a concern that that child is now becoming dehydrated and they need to be seen. What we usually do is if the child cannot take it by mouth, sometimes they have to get IV fluids. So if they are refusing to drink anything for a long time, also evidenced by decreased urine output, then they need to be seen. If they have a fever and they're not acting like themselves, so this is where the seizures could come in. This is where something like even meningitis, which is infection around the brain, can come in. So that should be one of your red flags. Now, fever lasting more than 3 to 5 days. It's rare that it's a range, but generally, by day 3, it's usually the worst of it for most illness when it relates to the fever. If you have a child who is day 4 and still spiking temperatures of 103, it is highly unlikely that that will be gone by day 5. But if it's let's say the temperature is 101, 100.7, you can wait 5 days before you see your pediatrician. Nasal congestion, and please, everybody has to remember that. To say it's sinusitis, it must be greater than how many days? 10 days. Thank you. Thank you. So nasal congestion that's worsening or not improving after 10 days, that patient needs to be seen. If they are coughing so hard that they actually vomit, that kind of ties in with dehydration or even other diagnoses like pertussis that may be happening. But that patient, once they start coughing and it induces vomiting, that patient should actually be reviewed by their pediatrician. If they have a cough that has been going on for more than 2 weeks and is not getting better, that is when you go to see your doctor also. And if you have signs of an ear infection, so remember we talked about the ear pain or the ear tugging, depending on the child's age. And also the development of red eyes. If you see a child develop red eyes, please just make sure your pediatrician is seen. Now, what can you do? So this is once again to piggyback off of Dr. Saunders' slide. You educate yourself. Education is key. They say ignorance is bliss, but trust me, it's not. Education is key. So you educate yourself on when you should be concerned. You educate yourself on what you should do, and you educate yourself on what we call the natural history of the illness. So you want to do hand washing in addition. Remember, the recommendation is 20 seconds. If you can't count 20 seconds, you sing the happy birthday song for twice, and that would give you your 20 seconds. Remember, most of it is from hand contact. In addition to the hand washing, make sure you cover, or your child covers their nose when they sneeze. Vaccinate. And it's interesting that we both had a little plug there, but you want to make sure you get your seasonal flu vaccines. You want to make sure you get any vaccine that is available and safe for the child to get at that particular age. So remember, certain vaccines like the flu, you cannot give to a child who's less than 6 months. And this final one, which is actually one of my favorites, is you have to do your pediatric well visits. I cannot once again overemphasize how important it is for your pediatrician to see your child when they are well. It makes so much difference, because then when there is a subtle difference, it will actually be picked up. But if it's a patient who you've never seen before, and then they come in, like, let's say for a rash, to kind of simplify it. The child may have eczema. You don't know what the baseline is. And so if the mom is like, okay, it's flared up, then you're like, okay, yes, it's flared up. So let's just try X, Y, and Z. But if this is someone that you've been managing for a while, you know they've always had X, Y, and Z, and now they didn't respond to X, Y, and Z, you pretty much recognize that, hey, this is something that we should take to the next level. So it's very important for you to please maintain your pediatric well visits. And then you can also go through what we call a fever plan with your pediatrician. And I usually kind of go over once again when to worry and also who to contact. Don't waste time waiting, let's say, for your pediatrician's office to open. If your child is day 6, has a temperature of 105, has green snot coming from the nose, and has conjunctivitis, you want to actually go and be seen right away. All right, that is it. And at this point, we will entertain any questions. Dr. Saunders, I think we made everything clear as mud.
I think so.
Good day. I have a question. Okay. Good day. Can you hear me?
Go ahead.
Okay, Dr. Saunders. Good afternoon, everybody. So back to when you said that if the child like is rubbing his eyes, and the eyes is like slightly red, is that something that you should be, so should we run to the pediatrician for that, to check that out? I mean, could that be a symptom of something severe, or could that just be allergies, or like if the child is teething, could that be a symptom of teething as well? If he has like bumps around the eyes, little rash around the mouth.
So, right, when I talked about the red eyes, the conjunctivitis is actually this persistent redness that occurs.
Oh, okay.
It is usually unilateral, not that it can't be bilateral. It's usually unilateral, but what you're describing as the child, and you're correct, it's more like allergies. You're describing a child that may have allergies. So they have the itchy, the red eyes, they're scratching. What you do is once they stop scratching, you notice that the redness gets better right away. But the situation with conjunctivitis is more where it's this persistent redness, and sometimes they can even have a discharge with it.
Okay, just wanted to clear that up. Okay, thank you.
And thank you for asking that question, because I'm sure a lot of other people were wondering the same thing. I wouldn't want the pediatricians to get upset with me when all of the allergies start coming in, demanding antibiotics.
Okay.
There's another question in the chat. There's a question in the chat. Should you give children vitamins?
I can take that one. All right. So, a lot of parents, when they come for visits, they want to know if their child should be on vitamins. A lot of parents want to give their children vitamin C to say boost their immune system because of the cold and the flu. But there are no real studies to say that with you having an excessive amount of vitamin C that it'll stop you from getting the cold. And I always say to parents, we get our vitamins and our minerals from the diet that we intake. And so if you feel that your child may have like a nutritional deficiency, or even with exam, we see changes, then definitely we'd want to do blood investigations to make the determination on whether a child may need vitamins or not. But a lot of persons feel that, and so the child's a picky eater, not eating all of the food groups, then definitely we would recommend. But, a lot of parents feel that, oh, my child has to be on vitamin C, but that doesn't necessarily mean it will stop a child from getting the cold.
So how would you recommend boosting the child's immune system?
All right, so I can talk and then Dr. Seymour can plug in. So first of all, with a healthy immune system, starts with your diet, okay? So you need to ensure that you're having adequate nutrition from all food groups. And because if you're getting adequate nutrition, you're getting your vitamins and your minerals through that. Other things in terms of boosting your immune system is sleep, exercise. So starting with the natural things, a lot of persons feel that, oh, there's some special fix that I give my child. Another thing that, I've spoken to one of our infectious disease specialists, elderberry, which is a natural supplement. Some persons recommend the use of elderberry for boosting the immune system, but I would say ensuring that a kid has some adequate diet and following things that sleep, exercise, all of those would help fighting. So I'm not sure if Dr. Seymour has anything else to add with that.
I agree. I will say though, I actually do recommend, well, not me, the American Academy of Pediatrics actually does recommend vitamins. So once they're six months of age and older, but yes, your nutrition is key. I mean, nutrition is key, healthy lifestyle. And this is why as pediatricians, we always talk about a bedtime routine. You should not have your 1-year-old staying up until 3 o'clock in the morning. And sometimes that happens. So you want to make sure they are getting enough sleep. And so I agree with Dr. Saunders on all of those things.
Okay, a next question in the chat. What's the likelihood of a child with a history of Kawasaki can have complications from the flu or common cold? And how high would you say is the high for them to run a fever?
Okay, that person must have some medical background. So, right, so the likelihood of so Kawasaki, for those who don't know, when you look at MIS-C is similar to Kawasaki, which is a condition in which the immune system is the problem. So they get exposed to something, they think it's you usually see it in people of Asian descent, but we have seen it so many times here. And so the thought is the immune system is overreacting. So I assume they're asking the question to say that, hey, if a patient has had Kawasaki, which means their immune system has already been acting the fool, what happens if they should catch the flu? Do you expect them now to have more complications? The key to this is basically the treatment. So remember, like I said, for MIS-C and similar to Kawasaki, we actually give them immunoglobulins. So basically what that is that's a protein. It's like an antibody that gets the immune system to calm down. So the thought is that if you could get the immune system to calm down, that's that. The issue with Kawasaki though is how much damage has already happened. And that may actually play a factor with regards to your how that patient responds to the common cold. So if they are caught early, Kawasaki can actually cause problems with the heart. If it's caught early and you don't have those complications from the heart and the patient does well and they get their vaccines, because we actually do want to make sure they get their vaccines because they end up going on aspirin also. So you want to make sure they don't catch the flu and so forth. But in any event, if that child, however, let's say they had Kawasaki and they now have the aneurysms in the heart, so they have a complication in their heart, When it comes to comorbid conditions, any viral illness can be worse with a patient that has a comorbid condition. And so then that patient would enter the category that, hey, they have a comorbid condition that puts them at a higher risk. There's no number I would say in order to say that, oh, if the temperature is this, you know, high fever is anything greater than 102, 103. So if you're having high fever, you would definitely at that 3-day mark. And like I said, if it's high fever, you use the 3. If it's not too high, you can use the 5. The best thing would be for you to make sure you're seen by your pediatrician. So I hope I answered that question okay. So remember, it's not the Kawasaki itself that'll be a problem, but if they have a complication of the Kawasaki that then puts them to having a comorbid illness with the cold, that's the problem, if that makes sense.
Okay, great. So is yogurt good for children?
Okay, so I'll answer that. Yes, I would recommend the use of yogurt. But I'd want to say if you're using yogurt, you'd want to ensure that it has a probiotic. It's good for GI health, so it helps with building up the lining of the tummy, and so it decreases the risk of kids having things like diarrhea, gastrointestinal symptoms. It's also good for bone health because it has calcium and other sources in there. And so yes, it's a rich source of vitamin B6 among other things. So we would recommend yogurt in our pediatric population.
Great. So the next question is, how do you differentiate between a common cold and a sinus infection?
Seymour, you want me to answer or? Okay, so I'm not sure Dr. Seymour heard, so no problem. So
oh, sorry, now I'm back on.
No,
It said my internet was unstable. Sorry. What was the question?
How do you differentiate between a common cold and a sinus infection? I guess I could answer it and then you can answer the next one.
Cool.
I guess you can add the next part of that is, how do you manage sinus flare-ups versus a cold and flu? So it sort of ties it together.
Okay, so we would have talked about it a little earlier. So with a common cold, you know, they have, cough, runny nose. Their symptoms are usually about 3 to 5 days. But we kind of ran home with the point that a sinus infection is when a kid has symptoms more than 7 to 10 days. And 10 days is the marker. And so if you see a kid, you know, a lot of parents come and say, oh, my child have sinus. You know, your kid may have allergic rhinitis. So allergic rhinitis is a kid that always has maybe stuffiness, itchy nose, itchy, watery eyes. But with a sinusitis or sinus infection, that the sinuses have actually become infected because of duration. So anything more than 10 days off having that persistent runny nose discharge, then we would indicate that as a sinus infection. Other things in older kids, they may present with fever. They may have tenderness over the sinuses, and that would be like at the frontal area, so on the forehead, or they may have tenderness on the lateral sides of the nostril, like on the cheekbones. And so all of these could be indicative of a sinus infection. So Seymour, they're asking how to manage sinus flare-ups versus the cold or flu.
Well, I think you can, I loved your answer. So like Dr. Saunders was saying, you may have allergic rhinitis. That is the most common thing I've noticed. Some parents would be like, oh, you know, my child doesn't have any medical illnesses. They just have sinuses. I'm like, everybody has sinuses. We all have sinuses. So remember, when you're talking about, oh, if you leave the AC on and the child's nose start running or they start sneezing, it's more an allergic rhinitis. When you're talking about sinus infection, a sinusitis, that requirement is for the child to get antibiotics because it has been longer than the 10 days and now the sinuses has a bacterial infection. If it's allergic rhinitis, so the environmental stuff just triggering their nose to run and so forth, we usually give antihistamines, and that's something like Zyrtec or Aries. So those would be the two mainstay treatments. Sometimes even something as simple for the younger age group who cannot take antihistamines would be just saline nose drops. And what the saline nose drops does is it causes vasoconstriction. So allergies is pretty much, once again, the immune system. It's these cells coming in and just causing a whole bunch of havoc in that area. And so what the saline does is it causes vasoconstriction to try and minimize all of those cells coming. And so you minimize the symptoms. The illness will go away by itself. Actually, it doesn't treat the illness. It's more so for the symptoms.
Thank you. So I have another question. Is it okay to tell a parent that cod liver oil, 70s cod liver oil is a good way to build a child's immune system or to make it stronger?
So cod liver oil is a Bahamian thing, all right? Everybody from babies are on cod liver oil. You know, you have parents coming in, they have their 6-month-old. Is it okay to give cod liver oil? So cod liver oil basically has omega-3, which is basically the fatty oils. And so it does give some benefit, but to say that your kid being on cod liver oil, that it'll stop and builds up an immune system to make it completely strong. That's not 100% yes, but it's a Bahamian thing, I would say. Everybody on cod liver oil, there's no contraindication unless, you know, a kid may have some, when we call like cerebral palsy, because you don't want to be just giving kids oil because that oil could go in the wrong place. Because it's supposed to go in the tummy, but if that goes in the lungs, then that's a bigger problem. And so, you know, even though parents give cod liver oil, we're kind of wary with giving children oil because it's supposed to be going down into the tummy, not the lungs, because it could cause what we call a lipoid pneumonia. And then they got to go see Dr. Seymour in the intensive care.
Hello, and we don't want that.
We don't want that. So I know, you know, it's a lot of Bahamian things that we do, and cod liver oil is a big one. Everybody on cod liver oil for immunity.
I'm guilty. So another question is, does a child that presents with common cold symptoms and slight wheezing be automatically classified as asthmatic? Or what is the age that a child can be classified as asthmatic?
Okay, that's actually, I'll do that one. That's a good question. So when it comes to the diagnosis of asthma, the key feature, in addition to the inflammation and the wheezing and the bronchoconstriction, is has to be recurrent. So it's something that happens on a recurrent basis. And then when they get the beta-2 agonist, which is the bronchodilators, they respond. Now, when you looked at the slide that we showed, and particularly with RSV, it can cause something called bronchiolitis, which is inflammation in the lower airways. And so those kids can present with wheezing. Not because it means the child is asthmatic, but it's just that that is what happens with that particular virus. So what do we usually do? We need to see that the wheezing is recurrent and responds to bronchodilators. And 2, usually we wait until after the age of 2, because the children less than 2, their airways are so small that just a little bit of mucus can cause enough constriction to get that turbulent airflow and therefore make the sound of wheezing. So it can just be from the virus if they're less than 2. We usually want to see that they're older than 2 before we give the diagnosis of asthma, and it has to be recurrent and responds to bronchodilation.
Okay, thank you. Another question is, can a baby 11 months have allergies? My baby's right eye constantly waters. It started from she was around 4 weeks.
So an 11-monther, yes, even though that young, they can have allergies. And so you'd want to look at the family history to find out what's happening. But not only that, you want to know what's the exposures. All right. And so, you know, what's in the room, what's going on with the fan? Are you cleaning the fans? What do you have on the bed? Do you have stuffed animals? Because allergies are triggers, and triggers can be things from pets. So do you have dogs in the house? Cats, it could be, you know, the cologne you wear, the cleaning products, dust. So many things that can trigger allergies. And so you'd want to start with a history to make a determination of what may be the triggers that may be causing a child. And so allergies can be watery eyes, itchy eyes, sneezing, itchy nostrils, where kids are always rubbing their nostrils, always you know, clearing their throat, always feel like they're having some postnasal drainage. And so, yes, but you'd want to start with history just to determine if it's an allergy or not.
Great. Okay, can sinus issues cause toddlers to have nosebleeds? If not, what may cause this issue?
So actually the most common cause for nosebleeds in children is a viral illness, just a viral upper respiratory tract infection. Remember, once again, I was saying when the virus invades the mucosa, it causes dilation, it gets all these cells, and in order for those cells to get to where they need to get, it's through the blood. And so you have increased blood flow to that area. So the most common cause actually is a viral illness. here's that word sinus issues again. So it depends on if you're calling it allergic rhinitis or if you're saying it's sinus issues, meaning a sinusitis. Yes, it can, because it's a part of the whole complication of a common cold, but the most common cause is just a simple viral upper respiratory tract infection. Unless, of course, you have other things like what we call a coagulopathy, like you have a condition where, and this is inherited, where you have a condition where you tend to bleed easily from your mucosal surfaces.
Okay, so this is our last question for the evening. What advice would you give a teacher heading back into the classroom on keeping herself or himself safe, other than the regular washing of hands and keeping the distance?
All right, so that's a good question. So first things first, I would say to the teacher, do class check, meaning that if you have a kid coming to school with that cough, that runny nose, that fever, the kid should be sent home. All right, you know, that's where it starts, because if you keep that kid in class, you're likely to get sick. Now, I'll say this, children's immune systems are a lot weaker than teachers. And so likely as a teacher, you've probably been exposed to at least 1,000 of them. Okay, and so you may not get as sick, but we're still masking. And so I would say to the teacher, ensure that you're wearing your mask around the children, because it could be COVID, you know, not everything that has cough and fever and runny nose may necessarily just be the common cold. So I'd say to the teacher also, ensuring that you have your hand sanitizers other than just washing, and keeping distance for the teacher, sleep, getting adequate sleep, making sure that you're eating, and keeping your immune system, yes, keeping your immune system boosted as you get back to these kids who are excited to get back in school. I know my kids are excited, and I'm excited too, because virtual learning, no, I'm ready for my kids to get back in school. And so that would be the advice. I'm not sure if Dr. Seymour has anything else.
Just the other thing I wanted to add was just vaccinate too.
Yeah. She said she's taking her cod liver oil.
Yeah, well,
so.
Yeah, you take the cod liver oil, but you also vaccinate. Take both.
Awesome. Good. She said she's vaccinated.
Ooh, love it.
All right. So all the best to this teacher in your upcoming school year, and may you do well for all of our kids as you know.
Thank you so much for answering my question. I totally forgot about the part of having to observe those children, because there's some parents who are not honest. Some parents wouldn't tell you that their children are sick, and because they're wearing the mask now, you really can't tell who has a cold. And so we've been asking the children, let us mask up and let's see what's going on.
That is true.
And so I am vaccinated and boosted. And I ain't trying to catch no cold or
That's
no
right.
Thank you so much for answering my questions. You guys did an awesome job. Awesome job. Thank you so much.
No problem. Thank you too for signing in.
Great, thank you. So please note that any questions that you were not able to answer or get to this evening, there is a link in the chat for you to send your questions to, and that is at Daniska, DANISKA.Barnaby@familyguardian.com. And we're also asking you to take a moment to just complete the survey that's been posted in the chat as well. Thank you. And I'd now turn the meeting over to Irene Pintard.
Good evening, everyone. I'm certain you enjoyed our presentations today. As we prepare for our kids to return to the classrooms, we appreciate the presentations provided today by Dr. Saunders and Dr. Seymour. I am pleased to say that I have learned a lot, and I really wish we had this environment some years ago when I was a young mother, okay? So on behalf of the President of Family Guardian, Mr. Glenn Ritchie, our VP of Bahama Health, Mrs. Charlene Rogers, and the managers and staff of Bahama Health, it gives me great pleasure to thank our presenters and our attendees on behalf of today. And so as we bring this information to help you get through the opening of school, we look forward to seeing you again at our next Doc Talk. Thank you and good evening.
Good evening. Thank you, everybody, for signing in.
Good evening. Thank you, everyone. It was a pleasure, Dashawn.
Yes, it was.